As we've been telling you, there are new rules from the Biden administration regarding masks. I'm sure you've heard about that. Millions of federal workers will now be forced to prove they've gotten vaccinated or face mandatory masking, weekly testing, and other things as well. For more on this new Delta variant and what's happening right now in this country, let's welcome in the Dean of the Brown University School of Public Health, Dr. Ashish Jha. Dr. Jha, good morning. Good to see you again.
Good morning. Thanks for having me back.
It's our pleasure, Dr. Jha. Question for you. How are we supposed to have a good science-based debate without any data? Besides this study that was done in India with a vaccine that's not even legal here in the U.S., where's the data to support us all wearing masks again?
Yeah, I don't know why that study got as much Twitter fame as it did. Look, here's the bottom line. The CDC had data from the United States, from what happened in Provincetown, what's happening in other states. And my personal take is that when they came out with their recommendation, they should have come out with the data at the same time. They didn't. I think the data is supposed to be released today. I think that was a misstep. But the data that they used to make their mask guidance update is not based on that Indian study. It's really based on data on what we're seeing here in the United States.
I want to talk about natural immunity. Basically, if you've had the virus before, are you protected against Delta? We could say with the flu, for example, you can get the flu vaccine every year, but you can still get the flu every year.
Yeah, and you can get the flu every year, and then you can get the flu again every year, right? So natural immunity is not perfect. And so the question is, how good is natural immunity? It clearly offers some degree of protection. I think at this point, the evidence is pretty overwhelmingly clear that natural immunity is not going to be good enough to protect you against the Delta variant. It'll help. It'll probably prevent you from getting super sick, but it's not as good as vaccines. And so I still recommend clinically that anybody who's had a natural infection and recovered absolutely get vaccinated.
What would you suggest to anybody right now as people try to cut through the politics and all the noise that's out there? What would you say to anyone who might still be on the fence when it comes to getting vaccinated?
Yeah, look, what I would say to folks is the reason I've gotten vaccinated, the reason everybody in my family, except for my 9-year-old who's not eligible, has gotten vaccinated is because the data on the vaccines is actually quite clear. There's a lot of misinformation being spread by everybody. Ignore it. Look at what people who understand what's going on are doing. 97% of doctors have gotten vaccinated. If this was some dangerous thing, you think most doctors would subject themselves and their families to it? No. The data is pretty clear. These vaccines are incredibly helpful. Now, look, with the Delta variant, you're going to get some breakthrough infections, a really contagious virus, but you're not going to end up in the hospital. You're not going to die. That's what we care about. And that's why I have been pretty clear about this, that if you want to get through the next 6 months, year, and not have to deal with this virus in a serious way, get vaccinated.
Dr. Jha, would you do me a favor and just put an end to the myth that it is only Trump voters who are vaccine hesitant right now in this country?
Yeah, that's nonsense. That's just not true, Rob. And I find it's both wrong and unhelpful. It's wrong because it's not right. There are lots of people who have not gotten vaccinated for all sorts of different reasons. And it's unhelpful because, like, why are we blaming certain groups of people? Lots and lots of Trump voters have gotten vaccinated. In fact, a majority of Trump voters have gotten vaccinated. We just should stop this nonsense and start looking at why are people holding off and then help address their questions and concerns instead of calling them names.
About 20 seconds left. We know the White House does listen to what you have to say. You've become one of the most respected experts on coronavirus. Where are you on lockdowns?
No lockdowns. Not coming, not anytime soon. Look, I can imagine in some places, if there's a horrible outbreak, hospitals are completely overwhelmed. You can imagine curtailing certain public health activities for a short period of time. But that is a very different thing than anything that looks like a lockdown. It's not going to happen now. It's not going to happen soon. I think people need to just get vaccinated and let's move on from this pandemic.
All right. Dr. Ashish Jha, we always appreciate it. Thanks so much for coming back on. Have a great weekend.
Thank you.
Hey, I'm Rob Finnerty. Thanks for watching. If you enjoyed this video, please join the conversation in the comments below. Don't forget to subscribe, too. Hit the bell icon to be alerted to breaking news. And remember, there's a whole lot more on Newsmax TV, America's fastest growing cable news network. Newsmax TV, we're real news for real people.